Welcome to another episode of Cutting Edge Health. And today what we're going to talk about is hip pain and why that hitch in your giddy up may be more significant than what you think. If we haven't met, I'm Dr. Orlando Landrum, the founder of Cutting Edge Health. And what we endeavor to do is to try to be able to explain different problems that come up from a pain standpoint, whether that's physical or whether that's mental health. And one of the things that we want to do is to help patients be able to understand not only their problems, but also how to be able to find treatments for it. Many a times not focused on just traditional treatments, but being able to provide exposure to other offerings that are out there. Prior to getting into the topic today, which is going to be predominantly based off of hip pain and differential diagnosis, or what are some of the reasons for why you have hip pain and an innovative solution, actually, we want to kind of touch base on another topic very briefly. And we'll kind of keep this banner that's going to be up for a period of time at the bottom of the screen to make people aware of just different challenges that exist. And so this is the month of May, which is ending as we come close to Memorial Day, as you guys very well know. And one of the things that we want to make sure that people understand is that it is Mental Health Awareness Month. And so the context of mental health is sometimes really not talked about in depth and detail. It can be skirted over pretty aggressively. And what we want people to understand is that we know that there can be a stigma that's associated with it. And so when we look at that mental health stigma, what we want people to do is to try to be able to break that stigma, for you to find ways to really be able to acquire help for different things that trouble you. And to really be able to lean into practices that help with that, so that you can say, you know what, hey, I know that I might have depression, or I may be anxious about things, or I may have some PTSD from a trauma that affected me. And accordingly, we want you to be able to say, can you lean into the healthcare system and providers that can be able to help you find ways to be able to treat both mental anguish as well as physical anguish? Okay. So there are a number of different treatments that are out there, but we'll kind of continue and talk about the aspect of hip pain. And as you saw in our initial slide, the aspect of why hip pain and why now, right? So within that regard, one of the things that we want to kind of do is sort of establish a basic understanding of anatomy. Normally, when most people think about the hip, they think about a picture like this. They can see this X-ray that shows this kind of ball and socket that's going into something and then something else, and we're not quite sure. Or if you're fancy, you might see something like this. that shows this blue kind of highlighting things and then a portion of a crescent or moon. And it's just really difficult to understand. So what we want to do is to make sure that we can break it down so people get it and that you're not being perplexed, and in essence, be able to kind of do the things that we always kind of do. And that is be able to explain it so that it's simple and that it's well understood. So that way you feel like you walked away from this being able to say, okay, I get it, I understand, and I can find a way to be able to find some way to be able to improve things. So when we talk about hip pain, the thing that we're going to talk about is the following. So if you can be able to see that crescent shape component or portion that's part of that is something that is the pelvis, and you can see that's part of the pelvis bone. As always, I just want to kind of make a quick divergence for a second for those of you who are joining from afar or joining as repeat watchers. We really appreciate you guys. Thank you so much for supporting our channel and letting other people know. As you go down to that second piece, you can see something that's called the labrum, which is the cuff that sits around the hip and can frequently cause pain. You can see this other area, this curved structure that is the femoral head, which sits into that aspect of this cup. And the cup is the next line down, which is something that's called the acetabulum. And then finally, you have the femur, right? So sometimes the 2D picture doesn't really give the best understanding. So let's kind of help by kind of giving you a 3D picture of the same thing. So in essence, if we were to kind of show you a larger spine, one of the things that you can see is that area of the spine, the pelvis bones on both sides, and you can see the hip. So here you can see the femoral head. Here you can be able to see the acetabulum and how it sits into that area. And then outside of that would traditionally be that ridge or cuff. That's the labrum that's in place. And so we're going to talk about that in context so you can be able to understand that better and get that semblance as we go through different things. As you guys very well know, one of the things that we really focus on is the context of understanding this within the elements of science. So we're going to rely on 3 different papers that are going to hopefully provide benefit and understanding. The first 2 are focused mainly on the hip. And then the third paper is one that looks at the actual, well, one way to be able to diagnose it that is new and is innovative. Okay, so the first paper and second paper are the following: differential diagnosis of pain around the hip joint by Dr. Tabor. And then the second paper is periarticular diseases of the hip, emerging frontiers in arthroscopic and endoscopic treatments. And then finally, one of the things that's going to look a little unusual, but we'll kind of explain it in depth and detail, and that is office-based needle arthroscopy, a standardized diagnostic approach to the knee. Now people are like, the knee? I thought we were talking about the hip. You'll get it as we kind of get into the context of explaining. So first, let's give you some ideas about what are some of the different causes of the hip. Because most people, they say, hey, you know what, doc, I'm coming in and I just got bone on bone for my hip. I need a hip replacement. And that's really what I think I got. But when we really talk about the hip, there's a number of different things that can pop up. You can have problems with labral tears. You can have problems with loose bodies. You can have something that's called a femoral acetabular impingement. You can have changes that take place with capsular laxity that's in place. You can have extra-articular problems like an iliopsoas tendonitis, an iliotibial band, gluteus medius or minimus tendinosis, greater trochanteric bursitis. You can have a stress factor. You can have an adductor strain. You can have piriformis syndrome. You can have sacroiliac joint pathology. You can have a number of different things that really can be a potential diagnosis for the hip. So some of these things kind of show up in the following fashion. So if we were to take a look, we can see this. We can see this. There we go. So we can see different changes that take place in the hip that end up showing up that when you do traditional arthroscopy, lets you be able to see various different components of the hip that show areas of arthritis and changes that are in place. And so what you can be able to pick out is things that look at the femoral head and how those areas have osteoarthritis that's associated with them. And you can be able to know that when you take a look at those things, you can see it under an actual scope and say, okay, I get it now. I understand that there's arthritis in the joint, that there's changes that have taken place with the hip. And accordingly, we can find ways to be able to try to address it, assess it, and then be able to deal with it going forward. So what are some of those structures and changes and issues? So some of those structures and changes and issues are the following. Things like a cam deformity, a femoral acetabular impingement. So what does that mean? What that means is when you take a look at the actual ball of the hip, it sits into a socket. And when it sits into that socket itself ends up showing a squeeze that can take place where it comes down over the hip, and it can be able to cause challenges and issues where you have this compression of the actual ball joint, and it prevents it from being able to move easily, right? And so that can give you some pain that can be prominent in nature and cause a whole host of different problems and issues. In addition, you can have other problems besides that. And so those include things like the following. Where you can see a labral tear that takes place. And you can see the arrow over here on the right-hand side, which denotes this change in that cuff that was made mention of before, that shows, in essence, a problem that takes place with kind of that area that is sort of the area that helps house the hip and keeps it within the area of the joint and provides good range of motion. And when that's damaged, you can have pain that's present, but not necessarily have arthritis or have other problems that are in place. So you can see this is kind of a pictorial representation or cartoon representation of kind of an old school way of being able to try to improve and treat that with a surgical type treatment for the labrum. Let's take a step back and look at some other potential causes and then kind of come back. So actually, this is one of the things where we're going to talk about some needle arthroscopy. So we're going to come back to that in just one second. But instead, what we're going to talk about is, so let's say you feel pain in the front, or you feel pain on the side, or you feel pain in the back. What are some of the things that could be causing it? So as May mentioned, you could have some degree of impingement, which can be caused by the anterior iliac spine. And that mimics some of the areas of like the femoral acetabulum. We're going to talk about that in just one second. That's next up. And then in addition, on the outside portion of the hip, you can have things like trochanteric bursitis, which we're going to talk about, or gluteus medius tendinopathy. We've covered some of those things in some of our previous talks when we had discussions about things like TENJET and how to be able to potentially treat it. Posteriorly, or meaning back near your butt or your gluteus maximus, you can have things like the piriformis syndrome, which we've covered in some of our other videos, or hamstring tendinopathy. And so let's go to that first portion that looks at that anterior inferior iliac spine impingement. So if you were to take a look, it looks like the following. And you may not be able to see that quite as well. So let me kind of take a step away from that and show it to you on a model. So if you were to take a look at a model, if you recall before, we have a smaller model now, and we can be able to kind of see this area that's in place, this portion of the pelvis. And then over here in the joint is where you can be able to see that area of the labrum, right? And you can see this area of the joint, and it sits into this component that's present here. This is the front portion of the spine. And if you can be able to pick this out, you can see that this area can have little calcifications that can come down and cause a compression within the area of the joint. And that's what you're seeing when we take a look at this picture, when you see this picture here. And so if you can pick out the arrow that's coming in from the left-hand side, you can see the ball of the femoral head that's present that sits in the joint. But then you see this little outpocketing of bone that sits over and causes a squeeze that's present and impacts that area of region of movement. So we talked about other areas besides the front. Other areas that we talked about are things like iliotibial band and greater trochanteric areas. And so this is a scope picture. And so a certain type of scope is a traditional scope, but you can have inflammation of something that's called the bursa. When that burst is inflamed, when you lay on one side or the other, it becomes painful and it's very difficult. Historically, that has been treated with steroid injections to that site, sometimes done blind, sometimes done under ultrasound. But there are some other things that can be able to benefit it in a much more robust way. And we've talked about that before. Things like a fancy name is called a percutaneous tenotomy, right? But what we basically mentioned, things like 10X or 10-jet, or even with probably a more robust solution will be an orthobiologic. So using some cells or treatments from your own body, like platelets or potential stem cells at that site, can be able to give you improvement, right? And so when we take a look at that, you can see that there's a way to be able to take a look and see the greater trochanteric bursa. You can see gluteus medius tendon. You can see iliotibial band, and you're like, Doc, who's seeing all this? And that's where we're going to kind of sweeten the pot a little bit and tell you, hold on. We're going to explain it to you so that you really kind of get what it is that I'm talking about and why these different scope pictures can make a difference. So this is a picture of a device that is called MyEye2. It is a needle scope. And people are like, what the heck is a needle scope? As a matter of fact, I'm going to show you a brief highlight from a video from one of the leaders in the field, Dr. Don Buford, who actually inspired a lot of things that I do in my own practice, because he's an orthopedic surgeon that uses regenerative medicine and is a phenomenal doctor in Texas that does research, that treats clinical patients, and is really one of probably the premier leaders in the field. But be that as it may, what I'm going to kind of give you a sense of is normally when someone has a problem with their hip, with their knee, with their shoulder, and they have a doc who says, hey, you know what, we need to get a scope. It requires you to come into a hospital or at the very least a surgery center in order to be able to get a sedation, because the scope is significant. It's large in size. Well, there's new technology that's out that's called needle arthroscopy. And that picture that I just showed you is one of those units and one company that manufactures it. And that scope is actually using technology that allows for a robust image, but through a small diameter needle, similar to what you might even get kind of an injection through. And it allows for people to be able to get a scope done in office. That's what I said. In office, potentially without sedation. And many patients don't need sedation for it. We could do sedation depending on the office, but many times you don't need it. And so a lot of people will say, well, why are we talking about doing something like that? And as you saw that one image pop up before, which I'm going to go back to, this is the reason why. The reason why is because you can be able to do a number of different things. Some patients can't be able to get an MRI. It happens all the time, whether they actually have implants that are in place and they have issues with being able to go through an MRI because they have a spinal cord stimulator or a pacemaker or AICD defibrillator, or they're claustrophobic, or they have problems with anxiety. They can't be able to do a traditional MRI. Or they have problems with being in a certain type of position. They can't be able to lay supine, or they have different other issues that are in place. At the end of the day, the value behind having a scope is it lets you be able to see a whole host of things that sometimes even X-ray and occasionally ultrasound may have difficulty finding, where it could be everything from a specific occult meniscal tear to you having different challenges with certain components of the ligament that might have a moderate tear. You could have things that are giving you issues that just traditionally wouldn't be seen. And sometimes it's really useful for patients that have had a procedure or surgery, and then they've had an MRI, which comes back as normal, but they still have continued pain and dysfunction. So it's another tool within the armamentarium of the advanced practitioner, whether they're an orthopedic surgeon, a pain anesthesiologist, a physiatrist, that says, hey, we want to be able to help you with musculoskeletal problems. And in order for us to be able to treat it, we need to know it and we need to see it. And those are kind of really defining principles of how can we be able to render good care by not hoping to get near the target, but by knowing that we're at the target. So some of those things that I made mention of before when we looked at the hip, those are things that can be utilized by looking at from a scope to be able to see it. Now, let me be clear. Traditionally, right now, needle arthroscopy is prominent within the knee, a little bit with the shoulder, but it's incredibly rare and is better for the skilled practitioner in the hip. So it's not commonly done in the hip, but that will change over time as the technique becomes more facile, more practitioners are skilled, and you can then be able to say, how can we be able to treat some of the most difficult diseases and problems by using a novel and elegant solution in order to be able to get a good result. So we're going to take a quick divergence for a second and show you Dr. Don Buford doing this actual treatment or evaluation with a needle arthroscopy so that you can kind of pick out what exactly this means. So you're looking at the side of the hip, and he kind of explains what it is that he's going to do. And you may not have the audio for it. So if not, I'll kind of give you some of that. So there's different points that you're looking at in the skin. You're going to give some local anesthetic at that site. And then what Dr. Buford is going to do is to be able to kind of take a look, figure out where the areas and the regions are. And I think this is actually, I apologize, one of his colleagues, they've seen what they've been able to kind of look at in terms of pathology under x-ray. So they know that there's some problems and some issues that are present there. And I want to say maybe this is actually Sean McMillan, who's one of the other docs, so pardon me. But then you're able to place this needle scope and get images just like as if you had a traditional arthroscopy, like in a surgery center or in a hospital, but can be able to really get benefit. And I won't play this ad nauseum and kind of bore you by some of their talk as they kind of go through the various different points. But at the end of the day, what we really want to kind of have that discussion and conversation about is the following. And that is, there are ways to be able to treat hip pains, and the hip pain is not always coming from arthritis. And we shouldn't just say, well, let's mask it by just putting steroid into the joint and hoping for the best. What we really want to do is to do a really prominent full-bodied physical examination, combine that with imaging technology, preferably with the aspect of ultrasound so you can see it under dynamic motion, but also being able to use things like MRI and X-ray where warranted to then get a robust understanding of the hip and then treat it as need be, preferably with probably the least invasive treatment that you could, and then go from there in order to get a degree of response. So I hope this video has been helpful. And that it provides value. And if it has, please hit the like button. We can use it, use that kind of share all the time, particularly for those of you who are watching this on YouTube. If you're subscribed to the channel, please let other people know about, the attempt that we're trying to do in order to be able to help the lay community understand not only what different pain problems are, whether that's physical or whether that has to do with mental, but what are some of the ways to be able to treat it as opposed to some of the traditional ways to do it? And those things haven't always cut the mustard. They haven't always provided value that has been useful. I know this is an unusual time that we're presenting today, which is typically a little bit later in the evening. Those of you who are able to join us live, thank you again. For those of you who are catching this at a later point in time, this banner at the bottom is talking about May and it being Mental Health Awareness Month. It is one of the things that we look at and incorporate into our clinic. It was so interesting, as a matter of fact, because I was at a recent conference that was focused mainly on treating different things like depression, anxiety, and to an extent pain. And I had one of the attendees say to me, why are you here? You're a pain doctor. You shouldn't be here. This is not for you. At the time, it took me back a little bit. And I was kind of like, wow, okay. But then I really got to looking into it. And a good number of patients that have pain have depression, and rightfully so. But interestingly enough, a good number of patients that are depressed that haven't been diagnosed with this, they actually have physical pain too. And the two go hand in hand in a lot of different ways, particularly as we look at different structures of the brain and how those things kind of connect and communicate. And what we really want you to understand is that you deserve to be treated as the whole person. You need to be able to not just be about what your physical is or what your mental is, but how can you be able to look at both in order to be able to give you the best care possible. And hopefully our channel can help you be able to be your own best advocate that lets you be able to punch pain in the face and get back to leading the life that you deserve. Thank you so much for joining us and have a great day.